Better health begins at Tidelands Health, dedicated to keeping the communities we serve healthy and active. That's why we're proud to present our podcast series, Better Health Radio, brought to you by Tidelands Health. Here's Bill Klaproth.
Chronic conditions like diabetes and high blood pressure don't take a break during a pandemic. Accidents and injuries still happen, and cancer still spreads. It's important that you continue to see your physician and get needed medical care. Delaying care too long can have severe consequences. So let's learn more with Dr. William Epperson, a family medicine physician at Tidelands Health. Dr. Epperson, thank you so much for your time. So what are some of the risks of delaying needed medical care?
Yes, we must understand that essential healthcare services are very important for patients. Last year in America, we spent over $3 trillion on essential healthcare services, and that did not just go away because of this coronavirus issue that we're facing. Many patients are missing much-needed healthcare services that could prevent very bad consequences. As you may have seen on newscasts showing that patients that could have had an early stroke managed to prevent problems, and many are dying or having permanent issues related to missing that opportunity. Many are having heart attacks, they're having delays in cancer treatment, diagnosis, and also, very importantly, in other infections. And so we're having much suffering and much deaths that are greatly increased because of lack of access to health care, because of so many reasons related to this virus in the communities.
Right. So people are concerned about seeking medical care because of the COVID-19 pandemic. So is it safe to return to doctors' offices?
We know at Tidelands Health it is certainly safe to return to our services. We've set up a program we call Safe in Care, and we are delivering care very safely. We carefully screen our patients to make sure that those who may be having COVID-type symptoms are being evaluated in appropriate areas, many times outside within their vehicles, whereas those who need essential health care, we can set up safe environments for them to come in and receive their care. And so, yes, at Tidelands Health, it is safe to come in. In fact, it's much safer to come see us than it is to go to the grocery store.
That's exactly what I wanted to ask you. Because of the Safe in Our Care initiative, people shouldn't be concerned about exposure to COVID-19 when coming to seek medical care.
Yes, if you're coming directly to my office to see me, you're as safe as you could possibly be. As you come into our facilities, our offices, our imaging centers, our surgery areas, our emergency room, we have mastered this. We are the ones that are controlling and treating COVID-19 spread and management. We're the ones that know how to prevent it just as well.
So, Dr. Epperson, if a patient has a chronic condition but is feeling okay, what's the guidance for this? Do they really need to see their physician?
Each patient is going to have a separate set of demands ongoing with that. A patient who has very bad lung disease on oxygen, it is certainly a good idea for them not to be exposed in any way to COVID, and many times this can be handled with their visit through telehealth. At the same time, if that patient is starting having symptoms of shortness of breath or just some other related problem, chest pain, that can't be managed through telehealth. So each individual has to be carefully evaluated over the phone to decide whether telehealth could be appropriate for the management or do they need to be seen.
Got it. Okay, that makes a lot of sense. So as far as people delaying care, and people have been delaying care, people need to understand that for general screenings, routine health checkups, elective surgeries, Tidelands is open, and the Safe in Our Care program with these enhanced safety measures really makes it safe for people to come back and take care of their health needs. Is that right?
That is absolutely true. It is safe to get care at Tidelands Health. And please understand that this COVID infection issue is not going to be gone in October, January. This is a very long-term issue, and the sooner we restart back to normal essential healthcare services, the more we're going to do to prevent people from dying and to greatly reduce the chances of the disease causing a lot of health consequences.
Right. And as we wrap up, Dr. Epperson, thank you so much for your time. Any final thoughts for us?
Yes, it's important to note that the healthcare in America, especially at Tidelands Health, we truly understand the COVID situation as it relates to our patient population. And because we understand that, we also know how to create safe environments for care, and patients can know that they are safe in our care at Tidelands. We're changing our hours, we're changing our time between patients, we have screening at the doorway, so many features that we have involved with this. So we know what we're doing, we know how to manage COVID patients, but most importantly, we know how to manage the far higher percentage of patients who don't have COVID and greatly need our essential healthcare services.
That is so true. So the overall message, do not delay care. And if you do delay care too long, it could have really severe consequences. So Dr. Epperson, thank you so much for your time today. This has really been informative. Thank you again.
Yes, indeed. Appreciate this opportunity.
That's Dr. William Epperson. And to learn more, please visit tidelandshealth.org or call 1-866-TIDELANDS to make an appointment. And if you found this podcast helpful, please share it on your social channels and check out our full podcast library for topics of interest to you. This is Better Health Radio. I'm Bill Klaproth. Thanks for listening.